Hello, YouTube. Trying to set up the camera. Nope. Sorry. Let's go ahead and get Facebook started. Alrighty. Hello, YouTube. All right. We are waiting for it to get started. Oh, we made it. Hello, my friends. My name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. It is Sunday, August 27th. I cannot believe it. The last Sunday, basically kind of over, because again it'll be September. Our local stores already have pumpkins in it. How crazy is that? Time is flying and moving so quickly. Sometimes it takes my breath away. Anyway, my purpose in doing these meetings is to patients who have interstitial cystitis, pain syndrome, pelvic pain syndrome, floor dysfunction, cystitis, Hunner's lesions, cystitis, genital syndrome of menopause. If you got bladder pain and you got pelvic pain, I'm your girl. Because my goal is to open some new doors, give you some new insight into what would be causing these symptoms. They're treated and so forth. My name is Jill Osborne. I bring to you several degrees. I've got degrees in chemistry development, graduate school in psychology. I am the founder of the IC Network. I've been the IC support group leader for well over 30 years now. And it is my honor to be here with you today. Now, it's always interesting when I do these meetings because so many people watch after the fact. So any do a meeting live, I have 20, 30 people here live. Within 24 hours, 5 of you have watched this. And so, or 400, whatever. So for those of you who are listening to this after the live event, I just want to say thank you for your support. And if there's any topics that you would like to see covered, if there's anything that you think is, please let me know. I would like to help. That is exactly why I'm here. Now, as weekend and summer, it is time to kick off IC Awareness Month because September is indeed IC Awareness Month. This is the time patients from around the world gather together to tell their stories and to share insight into how IC patients are being treated in your community, how it's being treated, who might need restroom, our doctor, and so forth. Because you are the eyes in unity, and that's really how I've set up IC. Oh, you can't hear us on Facebook? Well, that's weird. Hold on a sec. Oh, wrong microphone. Oh, testing 1 2 1 2 3. Let's try this again, shall we? Oh, life, right? It's kind of like when I write a magazine. I'll spend a month writing a magazine or something really hard on something on the IC Network site. Send it out to 30,000 patients, only to find it on the first page. Perfection is always an option. We always try our best. But for those of you on Facebook, okay, and now on YouTube, you guys have an echo. I don't know what to tell you about that. You have an echo on YouTube. Now that's very weird. Okay, it's gone. Okay. So let's try this again, shall we? My name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. This is our normal Sunday live support group meeting. When I come to these meetings, my job is to kind of educate you, inform you, open up some new doors, maybe give you insights on how to approach if you're struggling with cystitis, bladder pain, pelvic floor dysfunction, ketamine cystitis, COVID cystitis, Hunner's lesions, etc. That is indeed why I am here. And I love my job, and I love being able to spend time with you, and I love taking your questions. And so generally they organize these meetings. We do about a 30-minute little something educational, and then we'll take your questions for as long as you have questions. Happy to do it. Sometimes our meetings go 5 hours. Hello, Miranda. Hello, Heat God. Sometimes my meetings go 90 minutes. We see what you're feeling like. Whatever works for you, work for me. As I was explaining, we figured out that what our microphones wasn't working is that September is IC Awareness Month. This is the time when patients gather together around the world to share stories. This when we take a critical look at how are we being treated. Doctors treating us well. Are we treated with respect or minimized? Are you being treated by a doctor who doesn't believe that IC is real? Have you been told that it's all in your head? Have you been told that there's no hope? If you have, we use IC Awareness Month to fix that. Now I have I'm basically the person who coordinated IC Awareness Month for quite a long time now. And there's kind of a long history to Awareness Month activities. It started out as a day dedicated to research in November. That was done by the original ICA here in California 30 years ago, 35 years ago, a little longer than that. Then it was switched to October. Then it became a week, IC Awareness Week, and IC Week was coordinated company that owned, and so their version of Awareness Month was to promote their product. That's pretty much all it was. And then there were some politics going on in the IC world at that time. They dropped out. The IC Awareness activities died for a couple of years. I was kind of waiting to see if Interstitial Cystitis Association step up and take it. They didn't, and we decided to take IC Awareness Month, or IC Awareness Week, which we then grew to IC Awareness Month, because there's so much to share. There's so many opportunities for us to educate other people. A week really didn't long enough. So when we did that, the first thing we did is we had a vote. See, the problem with doing IC Awareness Month in October is all the media attention in October is on the Pink Breast Cancer Awareness Campaign. And it's just virtually impossible to get any in the media in October that's health awareness related. We as a group ended up deciding we voted and moved it to September because there are comparatively few awareness campaigns going on in the month of September. The other vote that we made was the color. What color do we want to use? And the color that we genuinely or generally use is going to be this teal backer. That is an example of a poster that was created actually the first year we did it by an IC patient that we have used for many years now. We've had some fabulous patient contributions to IC Awareness Month. So the way I've modeled IC Awareness Month is that it's about me, the IC network, or the IC. It's supposed to be you. It's supposed to be about your story. It's supposed to be about your community. If you live in Schenectady, New York, if you live in Houston, Texas, if you live in Portland, Oregon, if you live in Puerto Rico, if you live in London, you each have your own challenges, and you each have an opportunity to make a difference. And so if you go to our awareness website, which is icawareness.org, you find many different ways that you can participate. But really the most important way that you can contribute is out our press release, which I just this morning. Donna says there's an echo. Honey, I don't know why there's an echo. It makes no sense. Testing 1, 2, 3. My mic position. Always something. Okay. I uploaded our September 1st press release a half an hour ago. And the theme this year is about finding cause rather than effect, chasing the effect. And the example, I'm using two examples. I'm using genitourinary syndrome menopause, also known as atrophy, and I'm using pelvic floor dysfunction because there are women who have been told that they have an irritable bladder disease when they have a disease at all. They just have estrogen atrophy. And we know how to treat estrogen atrophy, and that is with topical estrogen and perhaps with something that will give the bladder a little protective coating effect. I worry about that because whenever you're told you have irritable disease, your life feels shattered. You feel like there's no hope. Your doctor may tell you that it's incurable and there's no hope. But that's not necessarily true. Now that we're phenotyping and we're able to narrow on your underlying causes effect, we're a lot better at healing people and of you curing you. And so back in the old days, our perception was that anybody who had frequency urgency pain had an incurable bladder disease. Well, we don't think anymore. Now we subtype or type. And the two groups I think that are the most disturbed and have been the most disturbed are women with estrogen atrophy and anybody with pelvic floor dysfunction. I was working with a patient this week who literally had been doing bladder therapies for 20 years. Nothing worked. Nothing for her. And she was just getting progressively worse, right? Not scary for her. She wanted newly retired, or she was forced out of work. So she was in an early retirement because her bladder was so bad, her symptoms were so bad. And that when I started asking her questions, what was so interesting is that she wasn't having bladder wall symptoms. She was having floor symptoms. And I said to her, honey, have you had a pelvic floor assessment? She said, no. And I said, that's the first thing you need to do. Because as an example, she kept saying her pain was on her left side. Wait, your bladder's not on the left side. Your bladder's centered. She couldn't start urine right away. She was hesitating 10, 15, 20, 30 seconds. You could release urine. That's a classic symptom of pelvic floor dysfunction. She had pain when she sat down. She had pain when she sat in a car. She had flare and she sat in a car for a long period of time. Okay. What does that scream to you? Pelvic floor. No doubt. She had pretty severe pelvic floor, but once we can start working on those muscles and healing those muscles, things should get better. Okay, so getting back to IC Awareness Month, and Sharon says here, it's not you. I have an echo to log out and log back in. So those of you on YouTube who have an echo, log back in, okay? And okay, it looks like to bug today. Thank you, Sharon. So what are you going to do? What are you going to do to help IC awareness in your community? Number one, we just print out our press release or save it as a PDF file, send it to your local paper. And it would be really great if you could say, I would like you to know how my life has changed because I have this pelvic pain condition. I had to stop working. I have had doctors tell me that it's all in my head. I have had people not believe. I have been denied restroom access in stores when I've been in any. I wanted my story because I know that other people out there who are struggling. Cool thing about your local paper is that they might, that you don't necessarily have to use your name. Of course, they would prefer using your name. But if you don't want to go on the record and say, I've got pelvic pain, I have to pee a lot, they might be able to use a sim also. Okay, so please think about that. Go over to icu.org. go to a kit, and you'll see it's the very first link, our 2023 IC awareness email or press release. How else can you participate in IC Awareness Month? Well, you know what? I always say, hello, Emma. Hello, Miranda, Donna. And hi, Sharon. And hi, Loretta. Hi, Danielle. Hi, Andrea. Hi, Kayleen. Okay, no echo. Hi, Andrea. Thank you for the 99 stars. All right. Yeah, we have a ton of questions coming in on Facebook. You guys. So, rather than being up all night crying in pain, I want you to use that pain constructively. Like really constructively. This is the perfect time to get your computer and write a letter to your senator and say, hey, I've been up every night for the last 2 years, unable more than an hour at a time because I have got this freaky pelvic pain condition that needs more research. I am asking you, I am begging you to support research for women's health and men's health and his pelvic pain. Like your anger or piece of paper, or write an email. You constructively. Don't just let it sit there and use that pain constructively. And then, one of the funnest parts of IC Awareness Month is our posters. So you can make a poster. And if you send the posters to me through the website, right, what we do is we pick a couple of every year to get Amazon gifts, and I'm always happy to do that. Now, in years past, we also nominated doctors, for nurses and physical therapists for Doctor of the Year, physical nurse of the year, and physical therapist of the year. I got that down during COVID because some patients weren't going to the doctor. That's still not quite time to put that back up. I think next year we'll probably, as things normalize and everything calms down, we will bring back the Doctor of the Year award, the Nurse of the Year award, et cetera, et cetera. All right. We also have samples for scripts for advice for public service announcements on the website. They also have a meme content, and the memes are great because memes you can be snarky. You can be soft and gentle, or you can be smart or even angry. And it's wonderful to express that because when we think about spreading what I see over the internet, it's all about images. People don't want to reach as they want to see an image to share. And some great memes submitted over the past couple of years. One, from kittens to Star Trek to just so many hysterical, funny things. So think about you can do a meme contest too. Yeah, and I'll be picking several at the end of September to get Amazon gift cards. And then last but not least, we also have daily that you can share across all of your social media channels. And so they come with beautiful images and a factoid to help educate people about what this is. Because frankly, aren't you tired of people not believing you? Aren't you tired of people not taking seriously? This is the time to kick some butt and say, hey, we're here. Stand up and be counted. This is free. No shame, no blame. We got hurt. Unfortunately, we got hurt in a part of our body that kind of sucks. That's embarrassing to talk about, but it is. Now, I've been filming all week our new mats on IC, and I'm linking all this week too. Really excited about it. It's going to be awesome. Basically 5-minute videos on anything and everything related to IC, from what is IC, what are the phenotypes, how is it diagnosed, how do you cure hydroextension, what are the treatments, the diet, flare tips, sex, it's all going to be in this mess, and I'm having a ball filming it. Now, the other interesting news is this. So for patients who were in the New Orleans area, had a very, very beloved doctor named Martha Boone. And Martha Boone was the IC in that area for a long time, and absolutely beloved by her patients. You know, she's an example of the type of urologist you dream of having, because you get a warm reception, you're believed from the first appointment, with a really good depth experience with respect to treating IC and lots of conditions. Well, you know, our challenge, good doctors are now retired or have retired. And I love it when those doctors actually take some time to share their wisdom in the form of a book or a blog, something like that. And that is what she has done with a book called The Fettered Urologist. That's released a week ago. It's available on Amazon. And if you want to just kind of understand the challenges urologists face, and how they approach the typical urology and pelvic pain and IC patient, it's really empathic. There are lots of sort of hope, and it will give you kind of insight into how she worked directly with patients. Her ICC section does not talk about phenotypes, because I wrote it before the phenotypes got started. But it just kind of her day insight and working with patients is just so incredibly good. Let me just see if I can. My experience with pelvic pain could fill volumes. There were points in my career when I thought the patient crazy. On particularly frustrating days, I thought I might be. When a problem is hard diagnosed and harder to treat, the patient, family, and the doctors share a microcosm of frustration. The truth lay in the realization that we were attempting to treat a multifaceted problem with few inadequate tools. Here I seek to summarize as simply as possible what I've learned of this complex problem of pelvic pain. In many patients, found an inciting event. Thank you. Like, single most important question at the time that I ask patients is there an event that you associate with the onset of your symptoms? And she asked that question. With some it was the bladder, vaginal or prostate infection. With others, it was a bladder catheter. With many, there was a history of trauma such as pelvic rupture, broken coccyx, emotional abuse. Some inciting event was a prior pelvic surgery, occasional childbirth. Rarely, the patient had no recollection of anything that could have led to their misery. I witnessed a familiar cycle with my chronic pelvic pain patients. They'd start out hopeful. If I just the right doctor, the right drug, this pain will go. And sometimes the more we did, the worse they got. Later in the process, the patients were angry and incredulous. Why can't you fix my problem? Then they became desperate and willing to try anything. This desperation gave way to depression. Is the rest of my life going to be like this? Marriages crumbled due to intercourse and loss of sexuality. Pain made it impossible for us to sleep and function. Many focused to work or care for their children at home. At times, they felt like life was, hold on. If what we called interstitial cystitis went untreated, the cycle ceased. Oh, okay. Here, one sec. I'm going to find a good section here. She goes over diet. She tells patients to make sure they don't have a UTI. She wants patients to get checked by a gynecologist just to make sure endometriosis and fibroid tumors aren't part of the problem. Aggressively about physical therapy. Physical therapy has been the most effective treatment for my pain patients. I explain the use of physical therapy for pelvic pain to my patients was simplistic but effective. When the body has pain caused by any condition, it reacts with muscle spasm in an attempt to splint the area and reduce pain. Repetitive muscle spasms cause inflammation in the area, which is a vicious cycle that worsens the pain. by manually rolling the pelvic muscles and teaching patients stretching techniques, the side broken and the pain diminished. Be sure you consult a physical therapist with special training in pelvic floor. She says avoid Kegels. She talks about treatments, oral medications, some of the medications, nerve block, etc. But anyway, this is really more insight into a urology as a whole. She talks about a lot of different things like urinary incontinence, testosterone. There's a lot of articles in here for men, after it's for men, alternative therapy, erectile dysfunction, kidney prevention and surgery, and so forth. So anyway, if you want to kind of see the world from the office of a urologist, this would be a fantastic book for you to get. So it's called The Unfettered Urologist, and it's by Martha Boone, MD. All right. And thank you, Dr. Boone, if you're watching this, for sharing hard-earned wisdom into the treatment I see in pelvic pain. And we really greatly appreciate the fact that you put that we can all read. You're just helping us change the world. Thank you so much. Hello, Helene. Hello, little darling. Little darling's echoing too. Darling, if you log out and log in, it should go away. Log out and log in, it should go away. All right. So we've got a lot of questions here. Let me start on Facebook here first, because we're simulcasting. When I'm looking here, I'm looking at Facebook. When I'm looking over here, I'm looking at YouTube. All right, righty. David, I just had a cystoscopy. The doctor said I had Hunner's lesions, localized, a couple. What do I need? Okay, number one, since you have wounds in your bladder, also known as Hunner's lesions, Hunner's ulcers, diet is everything. Everything. You've got to protect those wounds, especially since he did just fulgurate them, which is basically cauterize, helps to seal them. But they're vulnerable. So please be very careful with your diet. No coffee, no soda, no multivitamins, etc. Unless you're doing like a low acid multivitamin. There are two theories as to what triggers Hunner's lesions. Number one, it can be a viral infection, like the polyoma virus or the Epstein-Barr virus. With more and more research, which continues to find virus in some patients with Hunner's lesions, not all patients with Hunner's lesions. So I would ask your doctor to do a viral scan just to see if you picked up any or you have antibodies related to Epstein-Barr or even COVID, because COVID can also trigger changes in the bladder wall and trigger some symptoms. I also believe in, for some patients, Hunner's lesions are the result of severe neuroinflammation, sometimes due to a musculoskeletal issue. And I've shared that story of a woman, and granted this is a woman and you're a man, but her uterus was backwards because one of her ligaments had broken and her uterus free swinging. She had severe Hunner's lesions. She had a severe prolapse. When they prolapsed, her Hunner's lesions healed. So give that very compelling story. David, I would also really want to know the health of your pelvic floor. Is your pelvic floor in good shape? If it's not, then I do some physical therapy to kind of calm those muscles down, calm them down. I think it's very important. We don't have a self-targeted specifically because of the multiple causes, but I do have two suggestions. If you do come back with a positive virus, I would consider adding lysine, because lysine interferes with viral replication. If you ever have a canker sore, you can use super lysine chapstick, and that can really cut down the length of the infection. And so adding a little bit of lysine to your daily life would not be a bad idea. But you need to Google it, talk to your doctor about it, see what they. And or if we're going to follow the theory about nerves being very important, I would consider adding some PEAORA, PEAORA, to the mix. That is right here. Whoops. You saw my back there. Sorry about that. Okay. PEAOA, Peora, palmitoylamide, which has been studied in decades for pain. And the general consensus of researchers is that it works by getting nerves down. And so this might be an interesting experiment too. But ultimately, in the end, when it comes to research, the research proven treatments, you're looking at cauterization, you're looking at steroid injection, hyperbaric oxygen therapy, or lesions are completely unsafe to treatment, actually surgically them. All right, it's called a resection. Sharon says, woke up with what is most likely a UTI. Though I have IC, it's a different burning and different urgency. So Sharon, go get some UTI test strips and see if you can find that infection. It could still be a flare. Danielle says, my personal best, pumpkin seed supplements. Pumpkin seed, oh gosh, I remember when this research study was presented at the American Urology Association conference. It was for men with prostatitis. We don't have any studies which have showed that pumpkin seed is helpful for or women, quote unquote, with pelvic pain / IC. I don't see any harm in it though, but I would Google it and research it first. Andrea, thank you so much for the 99 stars. Aileen, how you feeling today, girl? All right, hold on. Sharon says, you look bright and beautiful today. Thank you, hon. I started the day. I am rediscovering life in the morning. Because when I was caring for my parents, the last one to sleep, and I usually didn't get till 2 or 3 in the morning, and I was getting up late. And now I'm getting up early. I'm getting up at like 6:30, and I'm like shocked that there are people walking at 7 in the morning. So I was already at our local park at 8, and I did a good walk this morning. And then I will tell you kind of a goofy story. And thought, you know what? Why don't you go check out mom and dad? So I haven't been over to their gravesite yet, and so I stopped at the store, got myself some flowers to put on their grave. I got to the cemetery, very, very long area. The office was, I couldn't find them. They were kind of like so because their grave is So anyway, it's a beautiful day, and I just stood there and went, Mom and Dad, it's a gorgeous day, and I can see everything is good here. I swear I heard my mom say, you take those flowers, you come home, so it's in your live stream. So that's it. And then I cried on the way home for a little bit. Anyway, it's okay. Kayleen said it's polycystic ovarian syndrome awareness and ovarian cancer awareness. I believe it. Alexandra says she's feeling burning down there. All right, Alexandra, where down there? Where? You gotta be more specific. Is it on the skin outside, or is it inside of your? If it's inside of your body, where? Your urethra? Is it in your vagina? Is it on your perineum? Is it by your rectum? You got to tell us more. Alexander said, I feel something in my vagina. Chronic problems, frequency. Okay. So depending upon age, you could have some bacteriosis going on. Maybe you have a yeast infection going on, or maybe just maybe you've got pelvic floor muscles so tight that they're causing a burning sensation in your vagina, which they often do. Hello, Sue. How are you today? Alex says, Jill, the black ears. Okay, honey. Does IC get worse over time? Not usually. The IC research shows that it really doesn't. One of the last big studies that I read several years ago was that patients normally hit the worst in the first 6 months, got better as they tried stuff. And I think that's even more now that we're phenotyping. because we're not going to waste a lot doing treatments that don't work. And so really the patients that there are two types of patients that I think can predictably get worse. Number one, patients who have Hunner's ulcers are not treated. Like the number one cause of long-term chronic in my office, and it just pisses me off all the time, is a patient who's they have Hunner's lesions, they've had the hydrodistension, the doctor says you have Hunner's lesions, and the doctor didn't treat them. Like, what the heck? Hunner's lesions respond beautifully to therapy, beautifully. And what the shows is about 85% of have their lesions treated correctly, the pain resolves or dramatically. So living with Hunner's lesions and not getting them treated or not doing that appropriate diagnostic workup to look for virus and neuroinflammation, I think that's going to be challenging over time, which is I'm here to kick you in the butt and get you back, doctor, and say, hey man, treat these. They hurt. I want to treat these. Why are you these? And no, Hunner's lesions do not respond to Elmeron therapy. They do not respond to, those typical treatments, the antidepressants and the histamines. It might help muddy the symptoms a little bit, but they're not going to kill a lesion. But we did share it in a past meeting. We had the European Society for the Bladder Pain Syndrome in New York, and for the first time we had a research team in Europe who looked for virus in Hunner's lesion patients, and if they treated those patients with antiviral medication. That was exciting, because at this point, yeah, everybody's saying, yeah, we're finding virus, but nobody's talking about treatment. And so now we have our first report of a clinic that's using an antiviral for patients with viral infection. And I'm very, very, very happy to see. I mean, it is kind of logical, right? I mean, if you have, so as an example, my ex, God bless his soul, he's unfortunately now passed, served in the Middle East years ago. This was 25. Well, how old am I? I was 35. Okay. And when he came back from the military, and I went and saw him, and we of course made love. When I flew home, the roof of my mouth was covered with canker sores, like 100. It was an immediate infection specialist, and the assumption was that it was something that he had picked up while he was. It was a viral infection that he picked up in the middle. Thankfully, it only happened once, and it ended up culturing out as herpes, the classic canker sore herpes, not the herpes that's transmitted, which was reassuring. Right. In that case, absolutely gave me an antiviral medication because I was in agony. So viral infections happen. Let's see. Then the other patient who I think has a really significant chance of getting worse are the patients who don't give their bladder to heal. Patients who love coffee and soda. And without understanding that, the bladder, like any other part of the body, can be injured. Generally, it's injured through some sort of toxic chemical exposure. That's going to be chemotherapy, ketamine, drinking way too much diet soda, too much coffee, energy drinks, things like that. And listen, your bladder is red, irritated, and screaming in pain at you, keeping you up at night. That's when you need to get rid of the irritant for a period of time. The hard reality is the bladder is the slowest healing organ in the body. It takes 2 weeks for one cell to be replaced, for one cell to grow, change, and fill in where one previous urothelial cells was damaged. So literally one cup of coffee will destroy an entire generation of stem cells trying to repair your bladder. So if you have one cup of coffee a day, you'll never get better if you have a bladder wall injury. And the same is true with soda and alcohol. I mean, you had an open wound on your hand. So would you pour coffee on it? And the answer, of course, is no. That's why I think it's very important. Stop thinking of IC as a disease, because our guidelines say that there's really no disease process happening in the vast majority of our bladders, except, say, patients who might have a UTI or fungal infection. The vast majority of us just know these processes happening. You think of IC as a disease, thinking I'm not going to let disease rob me of something. Oh, God darn it! I'm going to have my coffee every day. And that's flawed thinking, because what you're not understanding is that this really is more of an injury than a disease. A better way to think of this is, okay, if I have a wound in my bladder, would I pour coffee on it? No. Would I do it every day? No. Your job is to create an environment that will support healing. It's that simple. Jennifer says, I have Hunner's lesions for 10 years, so I have IBS and herpes. Okay. I'm 55 years old. I'm on a big trip to Asia. I'm getting both September, muscle relaxant, Motrin, anything else you suggest. Jennifer, I got a bunch of videos and articles over on the IC Network website, icnetwork.org, that talk about traveling. Okay. I've made trips, and so let me just describe how I do those. Number one, I pre-medicate. I know for me that I will get, now what I thought were bladder flares, or turned out were never bladder flares, they were pelvic flares. So if I'm in a bus or on a plane or for more than an hour, in many of those, many times my floor muscles will go into spasm. I mean, so I live in Sonoma County, it's 80 miles from San Francisco International Airport. A 2-hour bus ride on airport to get to the airport, or 90 minutes or whatever. And almost every time now I've gotten there in agony and crying my eye. I mean, hiding it, but crying. So what I started doing is I started pre-medicating a half an hour before I left with Fluril, which is a skeletal muscle relaxant. Now, not a whole one, into quarters. I did a quarter of Fluril every hour or two for the duration of the trip, usually every 2 hours. And so if I'm on an 8-hour flight, then I will just take in one pill in 8 hours, but just enough to try to stay ahead of any pelvic floor muscle spasms. The second thing that I do when I travel is I wear these like a beast. I put this on an hour before I leave the house. Betsy, I know it's echoing. It's YouTube. You need to log out, log back in, hon. Thing we're doing, it's YouTube thingy. There's nothing about mine that I've done any differently. Okay, here, hold on. Let me look in there real quick. I just see if there is anything going on in my settings over on you. No. I don't, you guys, sorry, I don't know what to do for you. Somebody logged out and logged back in the echo way. So just go ahead and try that out. Okay, getting back to travel. These are my saving grace whenever I travel. I put it on an hour before I leave the home. So in that hour, I've now got good, strong, steady heat. And I put it right here, but on the inside, you know. And obviously, you take it out of the package. You know what? Let me demonstrate it. Okay. So we've taken it open. This is the actual heating pad. The way you activate the heating pad is you peel off the back side. Okay, so we got the back side. There we go. And just stick it right there. Like nobody has a clue you got a heat pad on. Nobody can see it. So commuting, working, anything at all like that for any pelvic floor, these heating pads are like the favorite thing still in the IC Network shop. It's 3 for around $4. I think we've only raised the price once in 20 years. These are fantastic for traveling. Okay. The other thing that I've been known to pre-medicate, not recently, is a little bit of pain med, like a quarter of a Norco every 2 hours for the duration of the trip. I did that. I was in a really bad flare, and I had to fly to London. And I brought my microwavable heating pad, thinking they had a microwave on yeah, they don't. don't. My bad. And the flight attendant was great because she just put hot paper towels in a plastic bag, and I used that. But I always gave myself that opportunity to use a little tiny bit of paint if I needed it. Okay. To try to stay ahead of it. So let's see. Well, I don't even remember the last time I did that. When did I do that last? Oh, maybe 8 years ago, 7 years ago. So again, it was like a quarter of a Norco every hour for the duration of the trip. If you happen to have this, if you don't have the, and you can ask your doctor about it. And if your doctor's, tell your doctor how painful it is traveling. And can you get a very, very small prescription? Nobody's asking for 30 days. You just need a prescription for the day that you fly there and the day that you fly home, just you on the way. And see if your doctor will go. B says I'm echoing. B, am I echoing on Facebook? Jennifer says, what's Norco? It's like Vicodin. It's 5 milligrams of codeine, 305 milligrams of acetaminophen, and so it is an opiate medication. B, we know that there's an echo going on YouTube. There should not be an echo going on Facebook because they're on complete separate microphones. So Facebook is on this microphone. YouTube is on the microphone on the top of my computer that you guys can't see. Alexandra says, I drink decaf coffee. Is it okay? No, it is not okay. You need to limit your coffee for 3 months minimum and give your bladder an opportunity to heal, because it's not just the caffeine, it's the acid level. And then once your bladder has healed and calmed down, then you might be able to try coffee again, but you're going to need to do a true low acid coffee like Bella Rosa low acid coffee. In the interim, you can use Dandy Blend, which is a fabulous herbal coffee that I drink. I don't drink coffee anymore because my heart goes crazy, because I inherited my dad's heart. Last time I had coffee, I ended up at the emergency room. That's happened the last 3 times I had coffee, every single time. So I do herb coffee, Dandy Blend, which I love, which is in the IC Network shop. So Ann says, if you're healed, can you have coffee again? Yes, I can, but you got to do the right type of coffee. David says, what safe cereals and salads? Let me go get my favorite. Okay. So I was a widespread pain patient. I had frequency urgency in junior high, Virginia in high school, IBS in my 20s. My IBS was so bad. I had bend over and screaming every morning for years. Not lying. My friends were out getting married, having babies. I was laying in the fetal position in my bathroom every single morning. And eventually did an elimination diet. Found out it was oil that was putting me on the bathroom floor. I happened to be very, 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 very sensitive. What was back then? A lot of oatmeal, a lot of Cheerios, cereals that have oatmeal in it, and granola. And so we have to respect the fact that we each have different food sensitivities. The other thing that I found most of the traditional mass market cereals is they had high levels of preservatives, BHA and BHT. And I don't know about you, but whenever I ate those, I would be nauseous and swollen all day. I would be. I just never felt good eating cereals until I just found one. Hold on. Let me go get it. Ah. All right, hold on. I gotta close the cereal. This is gluten-free sprouted ice crisp made by 1 Degree. This is great. I can do this cereal. It doesn't bother me at all. So look for this one, 100 ingredient transparency, and the only ingredients in this are. Oops, hold on. Hold on. Organic spread whole grain brown rice, organic coconut sugar, unrefined salt, just a little tiny bit, and vitamin E. No preservatives at all. So this is I think a really bladder friendly cereal and an IBS friendly cereal. All right. Kayleen, hey girl. After that bladder installation Friday, pressure was high from pain at my dietitian appointment. I had to go to the ER Wednesday because of that. I was probably dehydrated from not drinking enough water, peeing a lot. It was also 100 here in Illinois. Even though I was in the AC all day, I sneezed that morning and it made me bulge out a little bit more. I did get fluids and the doctor moved back in. Yeah. Fortunately, no vomiting. My general surgeon appointment got moved up from October 30th to September 6th. Yeah, baby. Yes. Friday was such a relief from the bladder still. I think a lot of pressure is laid. Now I know never to ever again. That's what put me flare. Egg. Okay. Kayla, holding you to that, my friend. Holding you to that. Betsy on YouTube says she just ordered PEA and Cystomen from the AC Network and to remind how to start dosing. Okay, so the dosing instructions are on the bottle, but I believe in going very slow. And so I would start with the PEA first because There were no side effects in the ICPEA study, and PEA is really incredibly well tolerated by the vast majority of patients. The manufacturer's recommended doses too. It suggests that you start with one, do one a day for a couple of days, maybe a week or so. See how you do. You can go up to two. I take my 2 at night before I go to bed. With Cystomand, like any other chondroitin-based supplements, have the potential of giving you a stomach. So once you figured out PEOs, okay, I would do one capsule Cystomand and wait 24 to see how your stomach does with some food in the morning. You don't take it on an empty stomach before you go to bed. You want to eat it. You want stuff in your stomach when you're doing a chondroitin-based supplement like Cystomand. So again, do one a day for a week or so. See how you feel. You can go up to 2 a day for a couple of days, or see how you feel. You can slowly work up to 4. But just many patients stop at 2. There's this very important concept that I like to remind people about. It's called the lowest effective dose. What's the least amount of medication you can take and get beneficial side effect? And get beneficial effect. And as tempting as it is to want to take more and more, men are very sensitive, and I can't do that. So I personally look for what is the least amount I can take and still get some help from it. All righty, hope it makes sense. All right. So she likes good old-fashioned wheat, the little brown sugar or honey when I'm in a flare with lactose-free milk. I used to do cream of rice. I did cream of wheat too. I just didn't like the preservatives too. Sharon says burning body shiver when I try to pee at the UTI. I just tested, but wow, I think I got soap area while showering last night. One of us at the urogynecologist says the same. She takes a bubble bath. Absolutely. I took a dose of pyridium to calm things down. But that whole body shiver when you try to pee, that's don't let that go on very long. If you're having that tomorrow, call your doctor or go to urgent care and get your urine checked anyway, because you could have a false negative from a local test. That whole body shiver implies that you're having a bladder spasm. It kind of happens at the end of urination. Worried about that, Sharon. I'm a little worried. Vulvodynia normally doesn't cause a whole body shiver like that. If it were vulvodynia, it would burn, but it wouldn't make your body burn. So I think you need to be aggressive about that and see if you happen to actually, maybe it's a type of infection that doesn't, like a fungal infection. One personal rule: if you're scared, if so much pain, you're scared. That's when you go to the emergency room. If you're peeing blood, when you go to the emergency room, right? Okay. David says, I am constipated and rice will constipate, right? Rice of the brat diet, beneath rice, applesauce, sauce, and toast that you do when you have diarrhea. What is going on with this? Oh, it's scratched. That's why I'm seeing something weird. So I would do peas, honey, green peas. Remember, for you to have normal bowel movements, a man, you need 25 to 30 grams of fiber a day. So like, let's feeling a little low on fiber. So I had a big serving of refried beans last night, and I will follow that up today as well. So we got to get your fiber intake up and your water intake also. because it's a combination of fiber and water that helps. Not a lot, just enough to keep things moist, right? Kayleen says, I thought I could cheat on it since day. Girl, we've all done it. We've all done that. Laura says, my symptoms have suddenly calmed down after years and years, apart from being after sex. Good, Laura. Well, the burning after sex is in all likelihood tight pelvic floor muscles. So maybe that means that your muscles have calmed down. I hope so. Danielle says she gets body shivers too. So you call it a body jolt on the toilet. Really? Wow. That's like only happened to me when I've had a really, really bad bladder infection. And it was just, and it was as urine was just down into the urethra, the urethremes, in pain. The urethra is really, really, really infected. Sue says she gets body shivers when my pain level is high, and the doctor said there are pain triggers, which is the body's reaction to being in a high amount of pain. We get, in my family, we call it the Osborne shakes. So I always know I'm getting quite ill when I start shaking, And I can remember doing it as a child, waking up in the night, shaking uncontrollably, and going and laying with my mom, tucked in her arms as my body shook. And what was interesting is that that's absolutely a sign for me that I'm sick. Pretty sick. The only other time that I get shivers like that is if there's some very, very stressful going on. So a couple of times, and we've called the police for one or another, or called the parents for one thing or another. Especially with my parents, I would hold it together until the event was over or the ambulance had gone, and then I would start shaking uncontrollably, and I'd have to go into the shower with a really hot shower to get myself to stop shaking. That's a good stress shake, right? That is a good stress shake. All right. Speaking of using the restroom, I need to go urinate. So give me a minute, and I'm gonna go run to the bathroom quick. All right, and I will be back. All righty then. Okay, you're back to Sharon. says urine is a bit cloudy. I have a fight with cardiologist after my stress test shows that my heart is not working right. So now I have to add this too. Could be too soon to test. Shivers, I'm usually sick too. You can shiver when you're in shock. Yes. Kayleen said there are shivers, and mostly because the body drops dramatically. It could be something that's the vagus nerve. Is more common since they too stand, but it can happen too. Interesting. I didn't know about that. Pea shivers. Betsy asked on YouTube, is molasses an irritant to the bladder? I don't think so. Like if you're making ginger snickies, for example, with malt and ginger, I don't think it's the molasses that would be as irritating as maybe just the sharp spice. I mean, I don't think so, but you just have to try it and see how you do it. Sharon says, I have chronic BP and intractable pain. My only concern, you got trigeminal neuralgia, trigeminal neuralgia bilaterally in all divisions. Girl, heart, lung, Sjogren's, osteoarthritis, migraines, etc. Sharon, you know what this is? This is a honey. I'm sending 2 big hugs to you right now. This is the way the kids hug now online, is with these. I'm so sorry, hon. Now just remember that widespread pain has been directly related with an injured nervous system. The fibromyalgia, the IC could relate to the fact that your central nervous system is living in a constant state of fight or flight. And you got a lot of stuff going on. You got some auto stuff going on. It'd be interesting what they have to say about trying cephalosporin. I don't know if that would be real or not with your blood pressure issues. And here she said 2 open heart surgeries. It's looking like number 3 is going to happen. Girl, I have chronic regional pain syndrome. Oh, honey, I'm so sorry. Try to live in the sun. Try to live as much as you can. Every day is an opportunity. Things that bring us all joy, even in the face of struggling with illness. I hope that you can find moments of joy every single day, whether it's just sitting in the sun, whether it's watching butterflies flying by, listening to your favorite music, going to church, what gives you comfort. I wish for you. Anne says, how do you know when your bladder is healed? When you sleep through the night. When you can have sex comfortably. When you can drink a very mild coffee and it doesn't bother you. So let's remember receptive injury, right? So for those patients whose symptoms began because of a chemical injury to the bladder, so you can lose the coffee and the soda and the ketamine, whatever, for 3 to 6 months, let your bladder heal. But if you go right back in and doing it all over again, you're going to injure your bladder again. So that's why flares happen in patients after eating food because you flared your bladder, like with Kayleen, who had some, I think it was Mountain Dew on her birthday, 10 days ago or 2 weeks ago. That skin is new, fragile skin, and the last thing you want to do is it. I think I wrote a blog called Anatomy Utterly Ridiculous. I see, Kayleen, you're gonna laugh at this. I think I started the morning like with an omelet with salsa. Then at a afternoon, I had a smoothie with orange juice. This was really, this was 30 years ago, right? And then for dinner, I had something else that was really spicy. Ah, the worst flavor last night. And that was that night. And that was the moment that was like, Jill, the diet's real. You can't anymore. If you want to sleep, you can't do it. I was suffering. And I wrote a blog called I Am an Utterly Ridiculous because it was my stupidity. Because I knew about diet, I just like conveniently chose to ignore diet, and I paid a serious price. Mrs. Q says the audio is bad on YouTube. I don't know why, hun. I don't know why. Nothing has changed. It could be a problem with YouTube. Let me see if I can change microphones real quick. There goes the farmers flying over. I can't. I mean, you guys. I'll let you guys decide on YouTube. I can end stream and restart the stream. See if it'll go away. You want me to do that? I would be happy to try to do that. And meantime, Betsy switched over to Facebook. The other thing I might do is I might just upload the Facebook feed to YouTube afterwards. Okay, you guys want me to do that. Okay, so that's what I'm going to do. So those of you on YouTube right now, hey, I'm going to stream and then I'll restart it, and that fixes it. Okay, so